everyone, this is me again, Fiona, your subconscious mind surgeon, and you guys see me with Dr. Daniel Kim, plastic surgeon, board certificate plastic surgeon, celebrity plastic surgeon, and he has a lot to tell you guys today. We have a lot to talk about today.
Yes, we do.
And I think that you guys are going to really love our topics and the way that he will explain what to do, when to do, and how to do to not get botched by any plastic surgeons anywhere. So back to you, Dan. Tell me about yourself a little bit. And I know you for so many years. And before I came here, I was live with my audience and they asked me a million questions about you. And I said, well, guys, be patient. I will ask Dr. Dan and he will explain everything about himself. I know that you are a skilled, amazing plastic surgeon, which is hands down. But I know also that you have a personality of like a golden heart personality. I know that you are someone that always trying to help others. If someone asks you a million of questions about their surgeries, you're always there for them. I know that you try to always do your best to not allow people or allow actually your patients to do something that is not good for their body. Even if they want to pay you tons of dollars and it says, this is my decision, doctors, just do that for me. You're not gonna do that because you're always looking for the benefit or that's something that should not harm your patient's body. So please introduce yourself to our audience, followers, fans, and that from now on, guys, you are guys going to follow Dr. Dan. I'm gonna actually tell you when and how, but listen, today it would be a very good day for each of you that asked me in the past couple of years what I did with my lips, with my breast, who actually did all those things to me, and what is the best decision to do for the breast, best decision to do for the facelift and anything. So Dr. Dan is here to give you guys any answer you guys needed. Please, doctor, go ahead.
Well, good morning. My name is Daniel Kim. I've been in practice for 20 years here in Orange County, Newport Beach and Mission Viejo, California. Right now, primarily my practice is dealing with fixing things. Yeah, especially in Orange County, a lot of people have surgeries before they come see me. So
yes.
When they come to see me, I get a chance to reassess what they've done and get an inventory of what's wrong and what's right. Oftentimes they come to me for a specific repair. And so we get a chance to do a little bit of background check to see what has happened in the past, and that's when I usually get a heartache because oftentimes or not, patients do things to themselves that burn bridges. And so what that does is creates a situation where I can't fix certain things, and that's really disheartening. So part of what I want to do with your help and with your guidance is to start putting some information out there so you don't make mistakes and burn bridges. Correct. There are things that can be done at the right time, right place, right area, but oftentimes when I see people make mistakes, they usually get talked into something, or they do it at the wrong time, or they use the wrong tools to fix a wrong problem. And I think that if we can put some common information out there, I think people will be better off.
Oh, absolutely. So, Dan, can you tell us about a couple of things that you see almost every day when women come to your office and then trying to ask you questions about some, procedure that they've done some other places, and they come back and just say, please, can you just help us? What is the most common problem that those women may had, and they've been out there for some Beverly Hills surgeons or somebody's surgeries or surgeon that actually been with celebrities before and having a couple pictures example on the Instagram, and then they kind of think that, oh my God, this guy has to be a top because I see actually the picture that he has with the celebrity, and definitely I have to choose. But then when this woman wake up in the recovery and just like, oh my God, my breast is just like on top here and my throat and what I did, and oh my God, he sounds to be very perfect and he sounds to be awesome on the social media and a lot of pictures of the celebrities and other stuff. So what happened to me? So a lot of audience ask me about how can I recognize the good plastic surgeon and the plastic surgeon that is not having a good skill, but good but not having enough skills. So how they can identify those things together.
For me, I always tell people the first thing you have to check is to make sure that they're board certified in plastic surgery. They can't
What
be.
that's mean? Because to me, what I didn't know after you explained that to me, I didn't know like what that's mean board certificate. What that's mean board certificate? And like when you said board certificate, how long does it take for you guys to go through that course, or like what is specific things that you guys had to go to be approved actually by that or for that certificate?
Actually, in the United States, there's an actual body of people that specify what specialties are recognized. So first of all, you can't go out there and say, I'm board certified in what?
Oh.
Oftentimes doctors say, are you, if you ask a doctor, are you board certified? They'll say, yeah, I'm board certified. Yeah, but in what? And it's the back part that's important, not the front part. Everyone's going to say they're board certified in something. The back part, what's important with that? Some boards are not recognized. Some boards are just made up. So for example, there's no board of cosmetic surgery. There's no such thing.
Wow.
There's no residency program that specifically teaches just cosmetic surgery. There's no such thing yet. Oftentimes, even I'm called a cosmetic surgeon.
Wow.
I am a plastic surgeon, commonly termed cosmetic surgeon, but I'm really a plastic surgeon. So are you board certified in plastic surgery, or are you board certified in cosmetic surgery? Well, cosmetic surgery doesn't exist. That's not one of the recognized boards.
Wow.
So at the base of everything, if you go see somebody there, and they're great doctors everywhere, they have to be board certified in American Board of Plastic Surgery. Word for word, American Board of Plastic Surgery. That's important. That's very important. Why? Because I spent the first 32 years of my life going through the training program without missing a year, by the way.
Oh my
And it took me 32 years to get there. So that has value. What it does is that it gives you a quality control. That's what that is. So from there, can board certified plastic surgeons make mistakes? Of course. I make mistakes. We all make mistakes. But that's the baseline. You got to have that. Now, let me make a comment about
Please.
Newport Beach surgeon, New York, Manhattan
Yeah,
surgeon,
exactly.
Beverly Hills surgeon. That means nothing to me. You can find some of the greatest surgeons out there in our country and internationally practicing in everyday, normal, middle of the road America.
Correct.
We recognize it because we keep an eye on our colleagues and we see them. But I think that people out there tend to gravitate towards certain geographic locations.
Wow.
That really doesn't mean a whole lot. I see just as many mistakes coming from Beverly Hills or Newport Beach or Manhattan or wherever else
Correct.
as I do from Idaho and Ohio and wherever else. So I wouldn't necessarily pay too much attention to where their office is.
Wow.
A lot of plastic surgeons intentionally have offices in those keyword areas just to give that flair.
Mm-hmm.
But again, I think it's I'd rather they spend their time and energy and mind in trying to figure out how to do surgery better rather than trying to figure out where their address is.
Wow. Guys, that's amazing. I mean, thank you so much for that information because I didn't know, to be honest with you. And I know that people out there, they don't know either, almost nothing about that, how is the difference in between them. So one of my audience actually asked me yesterday, that is it possible to ask Dr. Kim about, I need to do surgery and I need to find a real surgeon. I actually consult with many surgeons, almost 10 surgeons in the past of 5 months to find out about the breast surgeries, is it right for me or not. She wanted to know how she could identify the surgeon who actually could have some red flags or the surgeon that could not have any red flags but also could actually give her kind of little bit of cold feet that don't really expect that type of the result. She wanted to know if the doctor told me that kind of I can't really do it or just it's kind of impossible for me to do that, but I will try. Is it the good doctor or the doctor that I go and just he says, whoa, you know what, don't worry about that. The doctor didn't understand exactly what he's talking about. I can make you exactly like Angelina Jolie, or do you want to Jennifer Lopez spot? I can actually give it to you. You want this and that. So she wanted to know that which one I should trust, the one that's telling me that maybe you can get a cold feet of that surgery and we don't know and I can guarantee because this and that in your body is not really correctly right, or should I just trust the guy that says, whoa, I have over 1 million people around and I did this and that, this is the picture of the a lot of people that I have and this and that. Should I trust the one that says don't worry about it, I can make you exactly what you want, like as a Jennifer Lopez, Angelina Jolie, whoever, or should I trust the surgeon that kind of give me a little bit like, I don't know, let's see, let's just think about it, let's just talk about it, let's just discuss about it. So what is your suggestion to them?
First of all, I mean, I could spend probably hours talking about that topic, right? Because I'm really passionate about making sure that people find the right doctor. First of all, you know, going to see 10 plastic surgeons, probably not a good idea.
Too much.
Yeah, because, you know, I like to see all my patients that come in and talk to me. You know, I don't have an assistant that go talk to people. So red flag number one to me, if I was a patient, is if I go see Dr. Fia and I don't get to see Dr. Fia, but I get to see her assistant, that's a red flag for me, right? Because what they're doing is they typically will do a lot of advertisement and they'll get 10 people. They know that of the 10 people, one person is going to do surgery. So why should he talk to 10 people? I might as well have my assistant talk to him. So that's a red flag number one. Going back to the patient standpoint, when you see 10 plastic surgeons, that's 10 hours of professional time. I think you can get just as much information out of visiting 2 or 3. For me, 2 or 3 is good. If I'm going to have surgery, I'm going to visit 2 or 3 people. I'm going to make sure that I pick and choose and make sure that the criteria, that the check boxes are all done, but 2 or 3 is plenty.
Okay, fantastic.
Second issue is when you do talk to that person, obviously you want to talk to that person. You don't want to talk to their assistant. You don't want to talk to some other doctor. You want to, if you want to come and talk to Dan Kim, you're going to come and talk to Dan Kim. And I think that's the way the super majority of plastic surgeons around the country practice medicine. Now, when you meet that doctor, to me, I think you should look for those 3 A's of success. You know, now he's board certified. We know that. What are those 3 A's? I kind of talk about it a little bit on some of my Instagram.
Wow, guys, it's important. Please listen. Go ahead.
These 3 A's are good for anything. You could be a guy that's cleaning toilets and buildings, but you want to be the best person to do that job. You follow those 3 A's, and it applies to everything in your life. But first thing is, you got to know what you're doing. You got to have that ability to do that surgery. How do you do that? You ask questions. And that doctor is supposed to give you answers. Not about what they can make you look like, but technically, what can they do?
Correct.
And it's like anything else. You ask me a question, Dr. Kim, how do you go about doing this? Or why would you do this? Or should you do this? You should be able to have a nice, comfortable conversation for about 10, 15 minutes on his ability. How many of these do you do? Do you do 1 a month, 1 every year, or do you do 1 a week? A very busy plastic surgeon will probably end up doing surgery on 200, 250 patients. You know, we're not making toasters, right? There's only so many hours in the day, so many weeks, you know, so they can only do so much. So keep that in mind and then ask the question, you know, how many of these do you do? Yeah, I can tell you, I do this many breast surgeries a week, or this many facelifts a week, this many tummy tucks a week. So that's a very, very good question to ask. Once you figure out that that person has the ability to do the surgery, then you ask that person, what are the key features that I should look for if I were to go to a different doctor? Okay. How do you grade that other doctor's work? So for example, tummy tuck, for example, right? Abdominoplasty. For me, the belly button has to look natural. You know, if you have a belly button that's really big or it's got different scar patterns, you're basically screaming out to the public, hey, I had tummy tuck surgery. Come look at my tummy. You don't want that. I mean, you do tummy tuck surgery so that you can have a good looking tummy, right, after you have kids. So why would you have a belly button that looks bad? So that's how I grade it. Number 2, where's the scar? Or scar can't be so high that you can't even wear a bikini bottom. Well, then that defeats the whole purpose of doing a tummy tuck surgery.
Correct.
Right? And then the third thing I look for is, what's the distance between the belly button and the scar? That distance has to be long.
Oh.
If the distance is really short, that looks really odd. That means either the scar's high or the belly button's low. Either way, you're not going to show it.
You're so amazing, because such things like that I didn't even know, because we are not a doctor, guys. You know that we are not the plastic surgeons. Basically, we can't even Google and find them either, because those information is a gold information, and none of the doctor are going to tell you, well, I will make your belly button have that type of the inches for and you know, it's so, oh my God.
But it makes sense, right?
Fantastic.
So if you were to interview a doctor and say, how do you grade someone else's work?
Wow.
Then he's going to obviously have to tell you, well, I grade them by 1, 2, 3, 4, 5 things. And that's a really, really good information.
Wow.
Because that means either they recognize that and do it that way,
Yeah.
or they have no clue.
Wow.
And then you go to the Dr. B, and Dr. B says something that's more insightful.
Oh.
And you go, okay, at least this guy recognizes it. The first guy didn't even recognize that, right? I mean, there are 3, 4, 5 other things that we can look at for as far as grading a tummy tuck result, but that's the top 2, 3.
Wow.
How do they manage upper tummy? How much skin do you leave behind in the upper tummy?
Wow.
There are a lot of things that we talk about.
I didn't even know nothing about
So
it.
that's just an example of how to pick a good doctor.
Well, Dan, I actually know that a couple of people that I know, I mean, they kind of telling me that, the doctor doesn't really, they don't like when we go directly to them and just like ask them a tons of questions. One of them actually even DM'd me the other day and says, oh, well, Fia, I had a conversation with my plastic surgeon, and then when I ask questions about my breast and a little bit more, I go further he was like, why you are trying to ask me those questions? It's not your business. It's my business, because I know all the technique things when it comes to the surgery, and I should not really tell you what I learned in the past couple of years and what I'm going to do with your breast. So she told me that actually he turned me off to just like, shut your mouth, listen to me, and I'm going to be your doctor, and I know what I'm doing. If you're not really happy with me, that this is the door, and go out.
Well,
and she was very sad. She says, Fia, it hurt me so badly because he was my surgeon for almost 2 years, and I thought that we have a very good relationship, but then directly when I'm asking questions about like a couple things that I had it in my mind, and I research it and Google it and all this stuff, he was mad. He kind of like, I'm defending by all those questions. So what if actually a patient finds some plastic surgeon just like sitting there and trying to talk, and the surgeon says, oh, I'm defending by all those questions. I'm not going to answer you because this is my responsibilities. This is my things that I did in the past couple of years. Then why you are asking me those technical questions? This is something that is belong to me, not belong to you.
Sure.
So how can that patient react to that attitude?
I would react to it like if I were to go see a financial advisor or attorney or anybody else that's more technical or more knowledgeable in a topic than me. It is their job to distill all those nomenclatures down to a commonsensical level where an average person can understand. Okay. That's my job.
So they should not back off and says, oh, okay, well, then I have to stop asking.
No, you can't.
Okay.
You shouldn't.
Okay.
Because you're going to use that person, that doctor or that lawyer or that plumber's information to make a decision.
Okay.
And if that person's not willing to give you that information so you can make a rational decision,
this is something is fishy inside, yeah. Okay.
Then how do you even trust that person to do the right surgery? Right?
Correct.
I mean, surgery is a very, very important part of a person's life. It's the only time in your life where you're giving up control of your body to somebody else.
Correct.
How precious is that?
Correct.
And that guy's not even willing to answer your questions. Forget it. I'm out.
Not even worth it.
I'm out.
Okay.
I wouldn't even.
How long does it take for you to explain for your patient about when you actually meet up someone for the first time? How long does it take for you? Like 20 minutes, 25 minutes, half an hour, 1 hour? Like when your assistant says, well, we have a new patient, want to do the breast surgery or breast implant, whatever. So how long does it take for you to communicate with her and tell her and just like, answering all the concerns?
It's like a bell curve, right? For the majority of people, probably about 30 minutes. I think it's a reasonable time for us to kind of talk. The entire time I'm talking to that person and that person's trying to figure out whether I'm the right doctor or not, I'm also assessing that patient to see if that patient is the right patient for me, right? So there's a verbal communication and there's also that non-verbal stuff that's going on. We will have people who will take a lot more time to get the information, which is fine. Oftentimes when I run out of time, I usually say, you know what, I can be available for you by you coming back to my office, or we can do a FaceTime chat, or we can do email or any other modality to answer some more of your questions, but please come back.
Yes,
yeah? But sometimes, once in a while, there's going to be a person who's going to be on one side of the bell curve where we're going to sit there for an hour and that person's going to talk 90% of the time, and I don't have an opportunity to give that person the information.
Oh, wow.
Right? So those people do exist. Those patients are really, really tough to deal with. I just have to be a little bit more patient. And oftentimes what I'll do is I'll just open up my clinic time at a different date, different time, giving them about 2 or 3 more opportunity to see if they could be a little bit better listener, right? You got 2 ears, 1 mouth, listen more than talk, right? So
Amazing.
if they go to that level, then they're a good
Amazing.
patient. But if they can't get there, then that's one of the red flags that we look for. To say, you know what, I can't do whatever she wants me or he wants me to do because I can't even give out the information.
Wow.
How can I work with this person?
That's true.
Right.
That's true.
Has it happened to you that new patient come to your office and then you directly walk into the room and you kind of feel like, oh no, I don't want to deal with her? Or somehow kind of you feel the energies that, oh, this is something that I don't want to. Or kind of you could feel that some kind of problematic kind of craziness come out from that surgery. Because you know that I'm medium, so basically I'm working with police officers, private investigators, lawyers, insurance companies, many to finding missing people, fixing the cases and all this stuff. So I go always by energies and the feelings that come to me. When I'm going to actually sign contract with anybody or any celebrities, any persons, I want to first feel if I feel good with that person or not. But I know that you're spiritual too. I know that you have a golden heart, and I know that you're always actually helping a lot of people. But this happened for you like in the past that you just like walk into the room, the patient is stay there, and just like this is a new person, but you did not even actually have a conversation with each other, but you feel that something just hold me back and I should not really continue to have a discussion. Maybe I should just cut it, maybe I should just like say something else. Is it just things like that happened before?
I think that everyone has certain feelings, right? I'm totally with you. It's people are either energy givers or energy takers,
Yes.
right? And so I do categorize
Vampires.
Yeah, I do categorize people that way. But at the same time, you have to understand that throughout our training, we are trained to take care of patients regardless of their affect, regardless of their energy, regardless of their ability to pay, regardless of anything. If they have a medical condition, we're trained to take care of that person. Now, plastic surgery is a little different because it's a purely elective surgery, but we have that gut, we have that reflex. So when I see patients like that, I usually try to give them multiple opportunities. So I'll bring them back again and again.
To feel again that if it's the right things to do, right step to do, and right, okay.
Now sometimes that strategy does get us in trouble. I mean, sometimes you can't.
It will be too much of the too much.
When someone basically says to Dr. Kim, you ruined my life and I didn't do any surgery to that person, that's a problem, right? But those are people that are on the fringes, and we all have to deal with people like that in our lifetime. But again, those incidences shouldn't really stop me from trying to give people multiple chances. I'd rather do that. Because oftentimes, by the time they come in like that with possibly a little bit of negative energy, oftentimes it's because they had surgery, it didn't go well, and so they're really jaded about plastic surgery anyway. They went through the pain, they went through the having the financial strains, they went through all that stuff, they lost trust in their doctor. And so for them to come into another doctor's office, they're gonna be energy takers, no doubt about that.
Of course.
But you gotta give them that chance.
You're so amazing, Dan.
Because that's true, guys. I mean, you see like how understanding he is. I think none of the doctors would even understand what he's talking.
No, that's not true. There are
That's
there are
true.
many great doctors out there.
I know it is, but
Through my own experience, actually, I have to say, many of them, they don't have even time. Just like 10 minutes, 15 minutes, I'm going to be in the room and just like my assistant is going to take everything and then see you like, at a hospital. That's it. I'm done. I heard that, I know them, and I know actually people who actually been and interviewed with them for a couple of times to do the surgery. But the way that you listening to people, and even you says, well, it's normal that they can take away my energies just because they maybe went through a lot of other surgeries which wasn't really successfully done, and they come to me because they beg me for help and connection and everything. This is, you're really touching my heart by telling, because directly when you go to the room, you just see the person's pain is not what you want to have after you just like get things done. So basically what you are doing, you are working with your heart and also trying to help her or him to understand about what else they can expect from you. And of course, they would adore you and they would appreciate you the way that you're trying to help them out with all those pain and negativities that they went through. So really touching my heart by telling this. This is actually super important, guys.
Very
really
important.
Super important.
Very, very important.
So let's say Dr. Kim, because many are like, why Fia says Dan? Well, because, I know Dr. Kim for so many years, so, he's the most amazing human being. That's why it says Dr. Dan or Dan, but Dr. Kim. So Kim, can you tell me about your personal life? I mean, a little bit about like many of you guys ask me like, do you have children, or does doctor have children? So yes, of course, you may have children. So now please tell audience, followers, fans that if you have children.
Yes, I have three three kids. My son is about to graduate from college. Not going into medicine. He's actually always had a place in heart to serve the country. So ever since he was a little kid, he wanted to go into the military. He had some opportunities to do that earlier, and he decided to experience his college life. So now that he's about to graduate, he's going to try to get into the Marines and become an officer there. So that's my son. My daughter, my older daughter, is third year in college.
Wow.
And I'm hoping that that maybe she might want to go into medicine. I think if anything, she likes psychiatry. I keep telling her plastic surgery is psychiatry.
That's true.
But hopefully maybe she'll go into medicine of some sort, some specialty. And then I have a 12-year-old, and I've been brainwashing her for 12 years to go into medicine. But who knows? Who knows? She's a great athlete. She loves rhythmic gymnastics, and so that's part of what she does on a daily basis. But hopefully she'll find a passion for something, hopefully medicine.
So guys, you got your answer. 3 beautiful children and successful dads with the golden heart. So Dr. Kim, can you also tell us about Botox and fillers? I received a lot of DM day before yesterday, and he asked me a million of questions, and we can just answer you with 2 or 3 or 4, not million. But one of them asked me how about if some nurse is going to put that filler on my face, and why I have to necessarily go to the plastic surgeon and plastic surgeon's office and then trying to pay a lot of money to them. Basically, I have a nurse that can buy things online, example, and we can do kind of like a Botox party, filler party in my friend's house, and then it was much cheaper and better. So can you please tell about the risk, and if it's and why the fillers is the art. It's not something that you guys can just put it. It's it's a syringe. Just put it there, back and forth. I want to be fine. All the wrinkles gone, right? Boom, boom, boom. It's not. I'm artist, and I know it's not. So fillers, that means art. If you go to any plastic surgeon or any type of person that's actually telling you that I can put a filler on your face, don't trust. Fillers for you could be very easy to put all the places, but it's not. So can you please explain?
Well, I think that if I were to take the arrogant side of my personality, I could answer that question by saying, anybody can go out to a local store and buy a canvas and a brush and paint something.
Exactly.
But the reality is the product is going to be vastly different based on your skill sets, right? That's one spectrum.
Correct.
The other spectrum is, nurses sometimes are, I believe they're technically better because they're used to starting IVs, dealing with syringes, some nurses all day long. But just because they can use a brush, just because they can paint a house or a wall, doesn't necessarily mean that they can be a good injector for Botox and fillers. Now, the reason for that is because this. You have to understand aesthetic values. You have to be able to assess a patient's face, and you have to be able to figure out as to what's most effective in what part of the face. And if you can't make those determinations, then you shouldn't do it.
Correct.
Right? So now, can you follow certain patterns? For example, in Allergan or various companies will literally have a chart that you can fold out, and it'll have a patient's face, and you'll have dots, and it says, this is where you inject, right? So now you're basically turning injection into, exactly. So if you follow those patterns, can you get a decent result? Absolutely. But oftentimes when I see patients come to my office, again, they've already had Botox, they're really jaded about it. They literally come to my office and say, I'll never do Botox ever again. My first question is, why? What happened? Well, my brow dropped and I felt claustrophobic for months. Well, first of all, at your age, with your facial bone structure and where your brow is, no one should have ever injected Botox into your forehead, right?
Oh my God.
Now, who gets to say that? Well, plastic surgeons, right? Because we were trained in aesthetic values, and there's a reason why we went through all that training. So all I'm saying is, let us evaluate.
Correct.
Let us evaluate. And once we evaluate, I'll tell this to my patients. This is what's good for you. I don't care if they come back to me for Botox or not. That's not even an issue. They can go somewhere else. As long as they control and tell the nurse, I want Botox here and here.
Okay.
Then go ahead. But once in a while, you'll still have to come back to me because your face changes, especially in women's face, late 30s, 40s, and 50s. Wow, big difference. I'll see patients on a monthly basis and their face is changing. So you always have to get reevaluated. And that's the part that I'm afraid nurses can't do. They just don't have the training.
They don't have
right?
actually enough training.
So it's either maybe you want to drive, ride a bicycle to work. Maybe you want to drive a sports car to work. You'll get there, maybe at different rates. But again, you choose. You choose as to what modality you want to go with.
But on top of everything, infection, when you actually go into the, party or some friend's party, and just like it's a Botox party, filler party, whatever. So there is actually the risk for infection because...
Yes and no. I mean, the face has so much blood vessel that even if somebody didn't follow certain protocols, very, very difficult to run into problems. The things that we hear once in a while, and I'll make this one comment. Generally speaking, a lot of doctors who are very experienced will try to avoid putting fillers in the lower eyelid for a couple of reasons. Number one, if that material goes into a vein, all the blood supply around the eye actually goes back to the heart through the back of the eye, through the brain, and back down to the heart. So if that material gets into the vein and it becomes an embolism, it goes, you can go blind. You can have lots of brain injuries. You can have a lot of bad things happen to you. So that's one area that I would really try to avoid, if at all possible. Yeah, just in the lower eyelid.
Through here.
Yeah, I mean, all doctors know this. Okay, so all doctors know that if a child has a infection around the eye, that's a medical emergency.
But Dan, it's so trendy right now. I see a lot of women who says, oh, you know what, I want to go and inject right there. I mean, like I'll put filler right here. It became kind of trendy because it says, oh, the darker spot will go away right away. They said that actually you're going to have a, beautiful youth if you do that. It's like, why does this become trendy?
I actually treat a lot of patients who ran into problems because of those injections.
Oh gosh.
Every morning they wake up, it'll be swollen.
You're a fixer. You always have to
And we have to fix all those things. I sometimes team up with people that are out there in the community. I'll have a dermatologist or a esthetician or a physician assistant that are out there doing the right things to help me get rid of some of that material so that I can get them back down to baseline, and then I can reassess and treat the patient. I can't do it all by myself. It's a teamwork with people that are around me. But that area is very, very dangerous.
Wow. So you guys be careful. When you guys really want to do something on the eye to remove your darkest spots, so just listen to Dr. Kim. So he knows what he's talking about. So basically, when you're even actually going to any plastic surgeon, just ask a million questions. What could be any complication, anything that come out of it, and don't just like lay back and relax and says, okay, just inject me, and I'm fine. Just ask questions and research and do more stuff. So. Kim, another things, there was another lady that asked me, it was actually 5 ladies that asked me yesterday and DM'd me about breast surgery. She said that she's 99 pounds, almost very tiny, 5'5", and she also wanted to know if she can have a big breast. So basically, I answered, I would not suggest you, but I would definitely talk to Dr. Kim on our interview tomorrow, and you will actually live see what's going on there. Are you suggesting that people who are actually having a tiny waist, tiny body, having a big breast just because they want to look sexy or whatever? Or are you kind of like telling that my opinion is about like don't do because of your neck, because of your back, because of a lot of things? Because I know that many of those that actually done that, they will come back to you after 6 months and says, can you please just remove it because I can't handle it anymore? So what is your suggestion if someone like very tiny, very small come to you and just like ask for a big boob, and then you're just going to say, well, what are you going to tell him?
I handle those situations two ways, very consistently. Number one, when they come in and they have a particular request, I verify that with examination and sizing. We can size patients by temporarily putting filler material into their bra to see what they can handle. Once I determine that they're really wanting to go to a very large size, I sit down and I give them what their future will look like.
Okay.
Right? So if you put in a 600cc implant, what will your future look like 5 years, 10 years, 20 years from now? What kind of injuries you're going to get? What kind of neck and back pain you're going to get? And I try to give them an information, 500 versus 400 versus 300cc implants, and I give them that information. That way, usually, people that are in the middle of the curve, they'll go, wow, I don't want to have neck problems, at 10 years from now. And they tend to automatically correct themselves.
Wow. Okay.
Right?
Amazing.
Yes. If for whatever the reason I get after a consultation and a nice conversation and I feel as though that the information's been given to that person, if they are still trying to get over or under what I feel comfortable, I as a doctor have the right to say no.
Wow.
I can just simply say, you know what, I don't believe that I can serve you best. I'm not the best doctor for you. Now, that should be a second warning to that person, right? Number one, 5 years from now, 10 years from now, you're gonna have back pain, neck pain. Second of all, Dr. Kim's not willing to operate on you. That's two big reasons why that person should say, maybe it's not
Kim,
the
it's
right
just because of scar tissues that actually the person going to build it. Like, let's say that, she wants to do a couple surgeries on the breast. So every single surgery is actually bring some, scar tissues inside. So
yes and no.
It will be the harder to just, again, explain or kind of exchange and go back and forth with it. Is it that also kind of be as a problem later on?
I do a lot of surgeries where a patient has an implant and then they come to me for a second implant surgery. And I always tell people, second breast surgery is like the best, most fun surgery a plastic surgery can do in breast.
Then why?
Because first surgery, the person doesn't have a pocket. The doctor creates a pocket, puts the implant up high.
You're ready.
And
Boom.
and then the implant migrates over 3 to 6 months, and it's going to settle down where it wants to settle down based on patient's chest wall shape, skin type, skin thickness, so on and so forth. By the time they come to me for a second surgery, they already have an established pocket, right?
It's already open. Okay.
It's already open, and the implant sits in literally a pocket called a capsule, and it's in a static situation. It's no longer dynamic.
Okay.
So now I can use that pocket. I can tighten up the pocket from the inside this way or this way or this way, and put the implant exactly where I want it. Right.
Okay.
So second surgery to me is the most fun surgery.
Okay.
Yep.
And how about the third and fourth? It's not that fun.
Yeah, it doesn't get any easier by the time you get to third and fourth.
I have to remove a lot of things. And
But it
just trying to
depends.
fix it,
I had a patient come in earlier this week, and she's a patient of mine, and I did her surgery a year and a half ago, and her right implant's a little bit, and she was a redo. Yeah.
Oh,
so
okay.
it was another one of these secondary surgeries. I got both of her implants way up high where it needs to be. It was really, really low. But she still has a little less fullness on the right than the left. Well, that's easy surgery. I can go back in there, take her implant out, tighten it up a little bit more, put it right back in.
That's it.
That's easy.
Wow.
Those are easy. That type of surgery won't give you any additional scars just because you go back into your third or fourth surgery, right? There's certain surgeries that are horrible third or fourth surgery, breast reduction or breast lift procedure. Every time you do those surgeries, you're building up all these internal layers of scarring that doesn't allow this breast tissue to settle down properly. So it depends. It depends on what kind of secondary
So a
surgery.
million other questions that actually I had from women yesterday. Facelift. So they ask, how old should I be when I should start actually thinking about facelift? And what is the new kind of method right now when your guys actually having right now is just like an up-to-date surgeon? So what is your suggestion? What age? And number two, if there any name of method for whatever actually your guys using to the scars is going to kind of minimize and nobody going to see the scars, where the scars going. Can you just tell them, because they ask me a million questions.
Sure.
It's like, I'm not a plastic surgeon, but I'm going to have an interview tomorrow. So please, go ahead.
Yet another topic that we can probably spend hours and hours on.
I know.
So I'm going to try to be very concise. As far as the age, to me the golden age is somewhere between late 40s on. You know,
Okay.
I see once in a while patients who want to get their facelift done way too early in their life, and for me, I like to always see something objective that I can see on physical examination.
Correct.
Whether it be a jowl or neck bands
Correct.
or lines in front of the ear, those are subtle signs that tell me that there are excess skin in the lower third of the face that may be improved with the facelift technique. As far as what technique that's out there are a lot of different techniques out there. What I will tell you generally is don't do anything in someone's office, because
Can they do that?
yes, there used to be a company called Lifestyle Lift, and they're gone. They're long gone. They're bankrupt and they disappeared.
Wow.
Their thing was, oh, you don't need general anesthesia. You don't need to go through a long recovery.
Really?
We can just do a facelift in 2 hours in someone's office. Well, you can't get something that lasts a long time by doing something ridiculous in someone's office in a couple hours, right?
Wow.
Yet, that company was successful for many years.
But then after that, back.
Of course, because people realized that 6 months, a year after their surgery,
It dropped.
they were right back where they were
wow.
before.
Wow.
So timing obviously is important. Everyone has different tolerances, right? Some people can't tolerate even a little bit of jowl or a little bit of neck pain. So it's not my place to tell them when's the best time. You know, sometimes patients show up when they're 60. Sometimes when they show up when they're 48. I look for objective things so that I can justify the surgery, because I can't do sham surgery, right? That's not being a doctor.
That's
true.
true.
I might as well go sell used cars
I
at
know
that
you.
point.
You
right?
always go for your reputation and credibility.
Right.
You would never do something that is crazy.
But it's not my job to dictate what patients willing to tolerate as far as what they see in the mirror, right? And then that's how you determine when. And then after that, it's just all about making sure that you do the right technique. Again,
Wow.
there's really
amazing.
well-established techniques that's out there that a lot of great plastic surgeons can perform. And I think you just need to get your information. But don't do something that sounds too good to be true. Pretty much every plastic surgeon that's out there that does a full lower third facelift use general anesthesia. We try to tighten up the muscle here. We try to mobilize the skin as low as possible. We try to tighten up the fascial system off to the side, and then just naturally your excess skin is going to cover your ear, and we just simply get rid of it.
Okay.
It's kind of like
So the scar is not actually showing to the face or something.
right.
Okay.
What we're trying to do is to say, instead of moving this furniture, I want to move the carpet under the furniture, and the furniture just comes along with it,
Super smart.
right?
Okay.
What people don't understand is, right now, the only thing that holds this chair in this place is gravity.
Correct.
But in human tissue, if I were to take this chair, it'll move back,
You got it.
right? Because it's not gravity that's holding it, it's the connective tissue that's underneath it. So it's our job to disconnect that relationship between the skin and the underlying tissue,
Wow.
tighten up everything underneath it, and then extra skin will just come out with it. That way you don't get this pulled look or weird look, you get a nice natural look. And that's what you want. One last thing, you didn't ask me this question, but I'm gonna probably say this,
Please,
because I get this
please.
question all the time.
I know.
They come in, they say, Dr. Kim, I want to do a facelift, but I don't want to look like so-and-so and so-and-so on TV. Okay? My answer to that is, if the surgery is done correctly, no one's going to know you had surgery.
Yeah.
By definition, when it comes to facial surgeries, you only see bad results.
Wow.
Okay, so you don't have to come to me and say you don't want to look like so-and-so, because that's not going to happen. Not just with me, but again, with many great plastic surgeons out there, if they use the technique properly, you're going to get a very, very nice, natural result.
Should I ask you a funny question?
Sure.
Then why, when we go to Beverly Hills, every single woman look like each other?
They use a lot of fillers, right? They use a lot of
They
fillers.
really look like, I kind of feel okay, they could be sisters, but they don't even know each other. The nose is the same, the cheeks is the same, the jawline is the same, the eyes is the same, what they are doing with them. I mean, it's kind of like, boom, everybody's look like.
It used to be more true in the past. I think doctors are a little bit more in tune with the way the patient's baseline is, and they're trying to make them look younger. You know, there's a big difference, right? So two type of people come to my office. Either they want to look younger, or they want to look different,
Oh, I
right?
get it.
And that's one of the first things that I have to determine. Does this person want to look younger or different?
Or different.
Right?
Yeah.
And to me, a very basic example would be an 18-year-old Asian girl. They have eyes like me. They don't have a crease, and they want an eyelid crease. Well, once I do the surgery, they're going to look very different.
You're right.
That's fine.
You're right.
Rhinoplasty, same thing. They have a hooked nose, and they're going to look different.
Correct.
But majority of people, they want to look younger. That means I, as a doctor, I have to see what their eyes used to look like 20 years ago. And my job is to get her back there or get him back there. Not to put my own spin on their eye.
Correct. Wow.
Right?
That was amazing.
That's a big difference. That's a huge difference. So in the past especially, a lot of doctors would just do the surgery exactly the same way. Same nose, same eye, same everything. So then people kind of look very similar.
Very similar.
But if you were to do the other way, look to see what they used to look like. I think my prediction is in the next, now going forward in the next 10, 20 years, I think people are going to kind of look different, but look younger. I think that's I wouldn't say it's a new trend, but it's the contemporary way of looking at plastic surgery and facial rejuvenation.
Fantastic. Oh my God, that was amazing, guys, because now I got my answer. That's why everybody's look like each other in Beverly Hills. Yeah. So maybe the new generation will look another way, but like right now I can see that everybody is like, oh yeah, they're sisters. The families.
Right when I was coming into practice in the late 90s, there was a guy named Jack Sheen up in LA, very famous plastic surgeon, very nice guy. I had a chance to meet with him, and he made all of his noses look the same. Oh. So then in LA, there were a bunch of people running around with similar noses.
Similar nose, yeah.
But it's different now.
What if actually a girl come to your office and says, I want to look like Angelina Jolie. Can you make me like, exactly, I want that face. So like.
Then I always ask for why.
Okay.
That's true with anybody. If someone says, I want to do breast augmentation, okay, why? It doesn't matter so much for...
But is it possible for that person to be exactly look like her?
No.
Okay, you guys got it? So if you guys go into any type of, plastic surgery's office and then you're having a celebrity picture in your hand and trying to kind of say, I want to be exactly look like her, and the doctor says, yes, I can do that indeed, just get out from the office.
You got an answer.
For facial surgeries, the why is a lot more important than other surgeries. Some surgeries are very obvious. I want a tummy tuck. Well, I don't need to ask why. You already have 2, 3, 4, 5 kids.
Yeah.
Easy. But with the face, you always have to ask why. Because
psychology.
Case in point, I have a patient comes in, they want a facelift. I say why, and they say I want to look younger. Okay, I can actually do a facelift here. They'll go see their friend who haven't seen in 3 months, and they won't even see any difference.
They're just gonna say, oh, you look younger. You look
no,
fresher.
they won't even say that because I didn't change anything here.
Oh.
And people look at each other in the eye. Unless your neck is really bad, they don't really notice all that much. Like I don't go looking at people's necks. I look at people's faces. I look at their eyes. So when you say why and they say I want to look younger, well, maybe we should look at your eyes. Maybe look at your brow position. Maybe we look at your cheeks. That's more important because that's what people see rather than their neck.
Fantastic.
Right? Why is such an important question? Just as important as to...
So one of your colleagues reached out to me and my agencies about a week ago, and unfortunately he had some problem with one of the patients of him, and he'd been sued by that woman and sexual harassment. And he's married, he has 5 kids. Now unfortunately he's jeopardizing his marriage, and because this woman trying to ruin all the reputation and everything. And reason that happened, he said that after the surgery, they are trying to text, basically you guys texting patient to make sure that is everything okay, and if you're okay, no bleeding coming and all this stuff. So he basically had a text from that woman and then like trying to come back with it as, okay, well, if anything happens, so please let me know even by mid of night. And then was sending some emoji, like a thumbs up emoji, sending heart emoji, example. And this woman take this heart emoji and just like finding some crazy lawyer to try to go after this surgeon and says, oh yeah, this is the sexual harassment. This is something that actually this guy trying to, hit on me or kind of crash on me or whatever. And she been actually a patient for him for almost 3 years. So basically it was some sort of trust in between them. But then we know that there's a lot of risk out there, and we know that you are guys risking a lot when you are kind of communicating with women all day long, like 25, 30 women a day. you don't know about their energies, but they do know about you and your skills and your energies, and you can have a stalker. They can come after you. They can kind of like ask you a million questions, and God knows for what. Sometimes they are just really, feel that you're hot. A plastic surgeon, they wants to kind of like come after you. Sometimes they just like wants to have some free stuff. Example, it's depend like why they are doing it. Not everybody, but there is people that actually do. So what is your suggestion? And you know that your colleagues out there, they do and they did have a problem and is still having that problem, unfortunately. So what is your suggestion? Like how would be the communication in between the patient, woman patient, female, and the plastic surgeon male, then when they are communicating about the surgeries that maybe recently they made it done or whatever.
Sure.
So what is your suggestion?
Sure. This is a very important topic. And again, we can talk a long time about this, but one of the 3 A's of success that I believe is availability. How do you follow up with patients? How are you available to the patients after the surgery when they're most vulnerable? So I personally believe that we have to be available via FaceTime, via text, whatever modality that's out there. So I wouldn't necessarily be scared or afraid to communicate with patients in that way. When I do a FaceTime chat with patients, I usually have them schedule it just like you would schedule a consultation, and I have a chaperone with me. And obviously, anytime I see patients in my office, I always have a chaperone with me. But other than that, after the surgery, communication, if the patient says, I need you to take a look at this area for me because I think there's something wrong, you can't say, no, I can't see you because I don't have a chaperone right now. You have to be a doctor first. Now, does that get us in trouble sometimes, like in this situation? Possibly. But you have to make a decision on your own as a doctor. You're going to be a doctor first, take care of patient first, or you're going to worry about yourself first. Yeah, we always have to put patient and patient safety first. Now, having said that, you can be very, very smart about not getting yourself in a certain situation where it can be construed in the wrong way.
Correct.
But if I had to make a decision, one versus the other, and if I feel like I really need to be there for the patient, I will always err on that side.
Correct.
Just the same way as somebody coming with bad energy coming to my office, you want to always on the side of giving them a benefit of the doubt. We always treat patient first. It's a touchy.
He did the same actually. He tried to took care of the woman and then or that lady, but that specific lady or the lady in question basically just used that heart emoji, which is actually sent by mistake to that patient, as a sexual harassment. So you see that there's a very tiny things. It's nothing to even count on it because come on, I did it. And he asked me that I have to ask you about that questions. Is it that happened to you as well? Because he said that there's a lot of colleague of mine actually saying the same things, that sometimes with women actually gave her body to you because you do the surgery on her, and this is a trust and love and light and everything that build it to you. Is it kind of normal that this woman later on kind of feel for you and kind of communicating with you more than often, coming to your office more than often and trying to see you more than often, or kind of, and just talk to you more like in a lovely way, and like just because she got some connection with you because of, that you healed her somehow, you make her to feel good? And what is that like? Is this something that you may faced before, or kind of like that plastic surgeon nicely or kind of like normally facing, because women give a body to the surgeon trying to fix, and then after that they building psychology, some kind of like a connection in between, or feelings? What is that exactly?
I think those things happen. It does happen.
Okay.
But if you structure your office and your interactions with that patient properly, they're going to abandon those ideas pretty quickly.
Okay.
Because if you're, if you are caring, yet with very clear-cut boundaries, I think they'll understand.
So it depends on the doctor attitude.
Oh, absolutely.
And the doctor assistants and personnel matters. So how they taken care of and how they categorize that they should not really kind of like get along, like always alone, like be alone in the room with a doctor that you had a surgery kind of, and then like have a moment to just like get more than what you want. So I got your point. So
it's a relationship, right?
Yes.
There's a patient-physician relationship.
Yes.
That as doctors they know more, they can do certain surgeries, and patients here. The minute it becomes more like this and becomes a more of an equal
then you have to
relationship,
push it somehow.
you got to put an end to that.
Okay.
Right?
And then how you can cut it is like, because everyone wants to do it like in a very manner way, or kind of not in the rude way, but in a very diplomatic way, and then push this relationship a little bit away, or just trying to actually that female know that, you know, I can't really be there for you when you wanted me to be, but you can ask me questions, or there is my assistant available, so you can call her, text her, whatever, but I'm not available that way. So is it because what do you think that he did as a mistake?
I think he probably had a part in it.
Okay.
If I was a guessing person, I don't know this person at all. But
no, that's true.
Because
that's true.
all relationship is bilateral.
True. That's true.
There's never a unilateral relationship.
100% agree.
If I never talk to you, you and I don't have a relationship, right?
100% agree with you.
Patient-physician relationship, of course we communicate. But again, you have to kind of balance that out. You have to know that.
Yeah.
And once it starts shifting, you can very diplomatically put an end to that.
Wow.
And everyone has different techniques to do that, but you know, you can be caring without really caring.
That's true. That's true. I agree with you 100%. At the moment, I wanted you guys to relax, just follow Dr. Kim ideas and all the suggestion. And Kim, do you have any other things that you can say? Oh, by the way, before I have a very strong topic before I say goodbye to Dr. Kim. How about the gym? Talk about that gym that me and you're talking
Orange
about.
Theory.
Oh my God,
Yes.
Orange Theory, guys. I mean,
please, I was amazed when you mentioned that to me. I was amazed when you introduced me to that gym, and I was amazed when you tell me that how you did and what you did with that gym. So please explain to my audience.
Well, Orange Theory Fitness is a fitness franchise that's been around for quite a bit now. It started in Florida. I got involved with it 3 years ago, just because I like
how
working
did you
out.
get involved?
I was doing surgery, and one of my surgeries canceled, and the nurse that was in the room with me said, well, if you want to work out, that's the place to go. So I had 2 hours that I can burn, so I picked up the phone, went to the studio in Newport Beach, and I did a 1 hour workout, and I loved it. So after that, I got involved more and more with it, because it's, most doctors know this, only way to elongate your life and have a better quality of life is you have to be cardiovascularly fit.
Wow.
Right? So Orange Theory has a very unique way of making sure that, you know, you can turn your brain off and go there 3 times a week, and next thing you know, you're in pretty good shape. Be able to do stuff with your kids, or, you know, if someone says, let's go for a 10-mile hike, that you have the ability to do that.
Wow.
So I kind of got involved that way. So now I have interest in Orange Theory Fitness in Hong Kong, of all places.
Wow.
So that's where I spend a little bit of my time trying to figure out as to how to spread and what they call bleed orange.
Wow,
Yeah.
that was an amazing name. Oh,
Yeah.
wow. Okay, so, and can you just tell us about the difference in between, the fitness, or better say the orange, was Orange Theory and Lifetime example, or some other actually, places. What is the difference in between?
The spectrum goes like this. You can hire someone, a personal trainer, for a certain amount of dollar per hour, and you can have a fantastic gym at home and do that. Obviously, most people can't do that. And then the other spectrum would be somebody who joins 24-hour fitness or any type of, we'll call big box gym, for pretty minimal monthly membership, and go work out on your own. Orange Theory Fitness should be kind of in the middle. It's actually more toward this side, because you kind of go into this reservation-based class for 1 hour. You have a trainer, and you have about 20-some people working out with you. But the instructions are given very clearly, and so you are basically in your own world with a heartbeat monitor. You know exactly what you're doing.
Wow.
You kind of go at your own pace, and so you get a pretty darn good workout. I used to have a personal trainer for about 1.5 years. My personal trainer, but I get a better workout at Orange Theory than with my personal trainer, because it's
so that's
very
the difference in
regimented.
between. Okay,
Yeah,
fantastic.
that's the sweet spot, I think, for the majority of people. But the monthly membership payment that they pay, it's very affordable, and you get a fantastic workout, and it's a no-brainer. You just show up when you're supposed to show up. They even penalize you if you don't show up.
Oh, wow.
monetarily. So you're even more motivated to go.
That's amazing, guys. You have
Yeah.
someone that's just pushing you and kicking you to do actually
Yeah.
exercise. And I heard that Orange Theory is actually thinking more about hearts and lungs. You know, like if you have a healthy lungs and hearts, that means that you're going to have a long life and healthy
absolutely.
life. So is it that what they are kind of?
Yeah, for example, if I see a patient that's 60 years old or older, we always make sure that their heart and lungs good before we even commit to any type of surgery. Why? Because those two systems are so important. If your heart's not optimized, if your lungs not optimized, we don't do your surgery,
Oh,
right?
yes.
So that should tell you that those two organs really have to be healthy.
Heart
That's
and lungs.
heart and lung. Heart and lung. Those two things are very, very important. So whatever exercise you do out there, you can go to the gym and pump weights for 2 hours and talk to your friends and chit chat. That's exercise, but it's not exercise that's going to give you longevity,
Wow.
right? If you want longevity, you want that energy, you got to put in a certain amount of cardiovascular workout. And of course, lifting weights and all those things are important too, and Orange Theory incorporates that as well. But half the time when you're in Orange Theory is spent in cardiovascular strengthening.
Wow. Wow. Thank you so much for those information. I mean,
My
like,
pleasure. It's
wow.
part of being a doctor is to make sure that people are healthy.
Wow. I didn't know that. I think that a lot of you guys didn't know that. So I knew that, like, have a healthy heart and healthy lung is super important.
Very
But I didn't know, like, if I go to the gym, just jumping back and forth 20 minutes, it would have give me exactly what I want for my lung, but sounds like not. So, Orange Theory, guys, orangetheory.com, and you guys can, how many places we are here? I know that right behind me, in Corona del Mar, I know in Newport, I know also a couple things actually around us. So do you remember those locations?
I go to the one in Mission Viejo.
Okay.
There are Orange Theory Fitness all over Orange County, in
Okay.
LA, all the major cities. There are over 1,000 studios now around the country and around the world. And so there definitely is one near you. In Orange County, Corona del Mar, Newport Beach, Laguna Niguel, San Clemente,
Everywhere.
Mission Viejo, Brea, Orange,
Just Google.
Long Beach.
Yeah.
It's all over the place.
orangetheory.com, Google, everywhere and around you, wherever. So fantastic. Well, guys, so you guys now get to know Dr. Daniel Kim. He's the most amazing plastic surgeon, and not just amazing plastic surgeon, a real human being with the golden heart, big golden heart. And he's available for you guys. If you guys have any questions, you can DM Dr.Daniel.Kim on Instagram. And at the same time, if you have any questions, you can DM me as well, and I can connect you guys together. Dr. Kim have 2 offices, one in Newport and one in Mission Viejo. So for more information about Dr. Kim office, Dr. Kim surgeries, and what Dr. Kim do and done, and anything that you guys need to know, you can come back to me and come back to Dr. Kim. Well, thank you so much. Thank you, Dr. Dan. As always, that was a pleasure to have you.
Always fun talking to you.
Really, and always fun to have him around. Guys, you're gonna love him because he's not just a plastic surgeon, he's an angel. Have a great one, and bye.